I'm using cable. I'm using the cable.
All right, Dr. Stefan, the floor is yours.
Welcome to the WHO Africa Media Briefing, which is taking place in collaboration with the AITA. First, some housekeeping. Please go to the bottom right-hand corner of your screen, click on the globe icon and select the language like this is the first thing. François, this is in French.
Oui, bonjour et merci de vous être joint à cette conférence de l'OMS. Si vous souhaitez écouter la conférence en français, merci de cliquer sur l'icône en forme de globe situé tout en bas de l'écran.
Sorry, I'm just going to come in. I think we were having a bit of a sound issue with Dr. Mary Stephen. So just to say that joining us from Brazzaville, Congo is Dr. Matisido Moeti, WHO Regional Director for Africa, and she will now introduce our panelists.
So greetings to all the journalists joining us for this discussion on vaccine passports and on the resurgence of COVID-19 in African countries. I'm really pleased today to be joined for our press conference by Mr. Kamil Alawadi, the Regional Vice President for Africa and the Middle East for the International Air Transport Association, also known as AITA. He will speak about the importance of ensuring that travel is equitable, easy, and safe for everyone. A very warm welcome, Mr. Alawadi. There have now been more than 5.3 million COVID-19 cases on the African continent, and 138 lives, sadly, have been lost. The third wave is picking up speed, spreading faster, hitting harder. We've surged past last year's peak, and at the current pace, continental cases will surpass the second wave's peak in just about 3 weeks. This is incredibly worrying. With rapidly rising case numbers and increasing reports of serious illness, the latest surge threatens to be Africa's worst yet. The epidemic is resurging in 12 African countries, and we are closely monitoring rising cases in another 14. Health systems are already pushed to the breaking point in a number of African countries. A mix of public fatigue and new variants are driving the surge. The Delta variant, which dominated India's second wave, has been reported now in 14 countries and has been detected in most samples sequenced in the past month in the Democratic Republic of the Congo and in Uganda. Africa can still blunt the impact of these fast-rising infections, but the window of opportunity is closing. So everyone, everywhere, can do their bit by taking precautions to prevent transmission. We encourage governments to make sure that all at-risk communities have access to basic prevention tools like masks and hand hygiene facilities. As WHO, we're providing guidance to governments and partners and working shoulder to shoulder down to the district level to strengthen public health and social measures to stop the spread of this virus. We're mobilizing additional experts to deploy to some of the most affected countries, including Zambia and Uganda, and to reinforce the capacities of a regional laboratory hub in South Africa to monitor the circulation of variants of concern. In the next 6 months, we're aiming for an 8 to 10-fold increase in the samples sequenced each month in Southern African countries. We're also incorporating innovative technologies such as PCR detection of some variants so that laboratories without sequencing capacities can understand the extent of the spread of variants in addition to sending samples for sequencing at reference laboratories. Africa urgently needs millions more vaccines. We need a sprint, not a saunter, to rapidly protect those facing the biggest risks. Cases are outpacing vaccinations, leaving more and more dangerously exposed. 18 countries have now used over 80% of the vaccines they've received through COVAX. The demand for these life-saving products is there. Now we need international solidarity and innovation to increase the supply. A collective effort is also needed to address vaccine hesitancy in our populations. Millions of Africans have now been vaccinated, and the systems monitoring for adverse events have mainly found only mild side effects in African communities. We're delighted that President Ramaphosa of South Africa and WHO Director General Dr. Tedros announced earlier this week that the first COVID-19 mRNA vaccine technology transfer hub globally will be established in South Africa. This international public-private partnership will contribute to closing the gap in access to vaccines, and it's a strong example of quickly translating political will on local production into action. Turning then to international travel. As an increasing number of people in richer countries are vaccinated, they're understandably looking forward to a summer of freedom, family, and fun. Increasingly, proof of vaccination is leading to fewer restrictions on movement. Globally, 16 countries are waiving quarantine for those with a vaccination certificate. While it's important to secure borders and keep COVID-19 from spreading, this must be done equitably. African people must not face more restrictions because they are unable to access vaccines. We're seeing different responses internationally. In a rapid WHO survey to which 45 African countries responded, air travel is open in all countries, land and sea ports are open in 37 countries, and only Mauritius is requiring proof of vaccination for international visitors. In the European Union, a COVID-19 passport system for vaccination, testing, and recovery will take effect from July 1st. However, only 4 of the 8 vaccines listed by WHO for emergency use are recognized by the European Medicines Agency for the passport system, while individual countries are also free to make their own determinations. The United States Centers for Disease Control and Prevention has provided guidance that applies to vaccines currently authorized by US regulatory authorities, as well as those authorized for emergency use by WHO. It recognizes those. As WHO, we would encourage approaches that bring efficiencies and multilateral solutions. WHO offers a service to all countries to quickly assess the safety and efficacy of novel vaccines and to assess policy options and provide guidance on matters critical to health. We hope that all countries will recall and respect the principles of the international health regulations, that vaccines must be approved by WHO and be of suitable quality and universally available before they can become a prerequisite for travel. Decisions on vaccine passports are taken at the national level in line with each country's unique epidemiological, political, social, and economic context. At the same time, they require coordination between countries, airlines, and interoperable systems. I'm sure we'll hear more about this from Mr. Alawadi. As WHO, our position remains that making proof of vaccination a prerequisite for travel may deepen inequities, particularly while the vaccines continue to be in such short supply. So once more, I thank you very much for joining us today, and I look forward to our conversation.
Thank you, Dr. Moeti. Now let's go over to Mr. Alawadi. Over to you.
Good afternoon, everybody, and thank you for joining us. As you are all aware, COVID has impacted the aviation industry in a very, very bad way. It's probably the worst impact on aviation industry for over the 100 years it has existed. Over the last year and a half almost, We have worked closely with many civil aviation authorities, airlines, health agencies, including the WHO, airports, and stakeholders in general, to try to save the industry, the aviation industry, from collapse. We are starting to see more countries open up their borders, which is a positive development. But we are still faced with stringent travel restrictions and requirements that are inconsistent with other countries in opening up their borders. This, of course, adds additional complications in travel and increases cost for the aviation industry and the passenger as these requirements continuously change and become more complicated. If we take, for example, the PCR tests, we will see that it varies between country to country from $100 all the way up to $400 for a single one-direction trip, making it even far more expensive for passengers to travel. There are priorities that we need to focus on, and predominantly they can fall into three clusters. The first one is the restart plan. What most non-aviation people don't know is that aviation is not a simple on-off organization. It's not a factory that you can turn on and then subsequently turn off and then subsequently turn back on. Aviation requires significant planning, a lot of training, and a lot of maintenance for the aircraft before you can restart. Unfortunately, without clarity, airlines are having difficulty to determine what sort of restart they will need to implement and how to do it. So we have worked, AITA has worked extensively within the regions to assist the aviation industry in the restart program, which includes things like review of operating procedures, training of pilots, engineers, cabin crews, and the production staff in general, and of course, a more effective oversight on the staff's progress. After a year of lockdown, this is vital that we do not start up the aviation industry unsafely. The other action that needs to be taken is removing the restrictions. And being involved both sides of the fence, I can simply say that these restrictions are the predominant issue that's faced by the aviation industry today. When we surveyed, we've done a number of surveys, and our last survey shows that 84% of the passengers will not fly if there are quarantines in place. Additionally, it is unclear today, in many cases, for the average passenger to know what is needed when he travels from A to B. When does he do the PCR test? What sort of certification is needed, and so on and so forth. The removal of travel barriers is the key to recovery. Right now, what is standing in the way of passengers traveling are the restrictions, not the virus. And airlines are ready to fly, and passengers are ready to fly. It's the restrictions placed by governments that are preventing flight. We've seen evidence where travel demand and bookings spike up the second government announces the opening of their borders. As governments start to accept vaccinated travelers, which is a positive development, we also can't have the situation where only people who have been vaccinated are able to travel internationally. We recognize that in addition to restrictions being removed from vaccinated customers, we need to see a robust and flexible testing regime in place to replace quarantine requirements, which is essentially what is killing demand and discouraging people from traveling. Therefore, governments should continue to accept systematic testing at the point of departure and consider the use of alternatives to PCR tests, such as rapid antigen tests, which are cheaper, accessible, easier to administer, and with quick turnaround times. It is also important for governments to accept WHO-approved vaccines when requiring vaccinations for travel. Working with the same international standards created consistency and fosters trust between governments and travelers after a year and a half of uncertainty. Still, on vaccines, while the move for many states to exempt vaccinated travelers from quarantine, or in some cases testing, is very welcome as it will help boost travel recovery. We also recognize the availability and pace of vaccine distribution and rollout across Africa is the least across the world. Therefore, we support the WHO's position that vaccination should not be mandatory, a mandatory condition for international travel to ensure equity and non-discrimination. The African Union has taken leadership in preparing for the restart through its Saving Lives, Economies and Livelihoods campaign. And AITA fully supports the African Union's efforts, which has made recommendations in line with my points above, and which are welcome and should be encouraged across states. Digital solutions is the last area that we should work on. Digital solutions to manage new COVID testing and vaccine requirements. Developing globally recognized digital standards that governments will accept for verification of travel vaccination and testing credentials will be critical. And I can't emphasize how critical this is for the safe restart of air travel. We call on governments to issue vaccination certificates based on the World Health Organization's Digital Documentation COVID-19 Certificate, DDCC. Issue COVID-19 test certificates in accordance with the data requirements set out by the International Civil Aviation Organization, ICAO, and accept digital COVID-19 tests and vaccine certificates at their borders. Where governments require airlines to check travel credentials, governments should accept travel-friendly apps, such as the AITA Travel Pass, to efficiently facilitate the process. And I want to pause here just to highlight our recent study. So in some areas, traffic has dropped down to 30% of what it was in 2019. And the time taken for the passenger to check in and clear his check-in process has doubled due to the complicated documentation process at check-in. If we increase to 2019 traffic levels, we're expecting up to 5.5 hours of time consumed by passengers during check-in. Unless we apply a smart way of digitalizing our health documents, we will face bottlenecks down the road. I will end here and happily take your questions. Thank you very much.
Thank you very much, Mr. Camille. Now that you have heard from all our panelists, it is your time to ask your question. To do this, please use the Q&A function on the Zoom platform. Tell us the name of your media agency and your name to have your questions asked. And then we have on hand Dr. Tiano Balde, who is the team lead for operational partnership, Dr. Richard Mihigo, the coordinator for immunization and vaccine development, and Dr. Nixie Gumede, who is the regional virologist on hand to answer your questions. Right now, we are going live. Omar, are you there?
Hi, good afternoon. This is Omar Mohammed from Reuters. Dr. Moeti, I wanted to ask about how WHO is working to expedite the new vaccines that are coming into place, which might help speed up the inoculation process on the continent. So we've had Cuba saying 2 of the vaccines have achieved quite high efficacy rates. And I just wanted to ask specifically if WHO is working with Cuba to provide emergency authorization for those vaccines. And just very quickly to the gentleman from IATA, I wanted to know what is your projection in terms of the losses that African airlines are projected to incur in 2021? Thank you very much.
Okay, thank you for that question about the Cuban vaccines. Actually, I'm not aware personally, and perhaps my colleague Richard might be aware if our team in Geneva, which does the work of the emergency use licensing and the assessments, is yet in touch with the Cuban authorities in relation to their vaccine. But you know, Cuba has been a good contributor to global health, particularly in Africa, in terms of support, especially with human resources. And as WHO, as part of the COVAX partnership, we are ready to look at all vaccines that are available and go through the process of assessing them with the objective of offering to countries our guidance for as many vaccines as are available globally in this very difficult vaccine availability situation. So I'm not aware, but I'm quite certain that our colleagues will be ready if the Cuba offers its vaccines for distribution internationally to support the EULing process. This will enable then African countries to be able to use that EUL process as the basis for their own accepting and accessing these vaccines. Our objective is really to get the vaccines out there and reduce the inequity that is the situation at present.
Yeah, so the question was, what is IATA's projection on the losses for the aviation industry in Africa? The exact number is not with me right now. What Africa did suffer was $7.7 billion in 2020. What concerns me is the 7+ million employees in the aviation sector in the African continent. If the situation remains as is this year, we're looking at similar numbers. And it's whether the aviation industry can sustain this level of punishment for a second year is the vital question. It's a worry. And if you consider that already there are 8 airlines that filed for bankruptcy in Africa, the last thing we want is for further airlines to file for bankruptcy. It's important not to project what we believe are going to be the losses for the aviation industry in 2021, but rather spend more energy on focusing collaborative work with all the stakeholders, including governments, to support the aviation industry in Africa and prevent any further damage or even closure of airlines, or even the supporting companies like catering companies or MROs or training organizations. This is where we're trying to focus on at this particular moment. Thank you.
Thank you very much, Mr. Camille. Richard, do you want to weigh in, please?
Yeah, thank you, Dr. Mary. Yeah, just to add to what Dr. Moetev said, and to elaborate a bit more on the question asked by Omar. I think WHO, working with the Africa CDC, has developed a regulatory pathway to support countries in the approval of the vaccine. And this regulatory pathway has 3 major scenarios. The scenario number 1 is the vaccines that have been have received the EUL authorization by WHO, which is the majority of the vaccine so far. We do support country to quickly, once the vaccine has been EUL approved by WHO, to make sure that the country can use them quite quickly. So that's the easiest way. There is a second scenario for vaccines that have been only approved by what we call a stringent regulatory authority, but have not yet received a WHO EUL. So we do have as well a whole pathway on how we can support countries in looking at the dossier, helping them to assess the vaccine, and eventually provide the authorization. And this is under scenario 2, before WHO provide the EUL, for instance, for Sinopharm vaccine. There were many countries in the region that were using Sinopharm vaccine, for which we use that particular scenario to support them. And then there is a last third scenario, is for vaccine that have not received neither the EUL nor the stringent regulatory authorization. And this is where the Cuban vaccine falls in. So I think if that's become the case, so there is a pathway that has been put in place to see how we can help countries to access the dossier, to support the review of that dossier. And if that become available, then we will prepare better to support the country. So we do have a whole regulatory pathway scenarios in supporting countries when it comes to approving of the vaccine. Over.
Thank you, Dr. Richard. The next question is coming to you, Dr. Moeti. This is from Mira from British Medical Journal. A lot has been voiced about vaccine inequity, and wealthier countries have now finally pledged greater donations. But could you please comment on the reality of rolling out the vaccine across Africa? Are these numbers enough? If not, by how much does Africa need? Then the second question, are vaccines really going to make enough of a dent on the continent to help control the pandemic in here now and in the long term, and what else is crucial? Over to you, Dr. Moeti.
Yes, thank you. Thank you very much. I think that's very much the issue of the day. You know, I think African governments and people have appreciated the promises, statements, indications by wealthier countries that they are ready now to donate some of the vaccines that they have procured for their populations as they have reached certain levels of coverage of their populations. I think we see that if we take an average of wealthier countries, they've covered about 60+% of their populations, whereas in Africa, we're really hovering around 1% or so. And so it really is a huge concern of the inequity now. So to reach WHO targets for fully vaccinating 10% of the population on the continent, there is need for an additional 215 million doses. And to reach 30% by the end of the year, Africa needs an additional 700 or so million doses. So that's the scale of need from Africa. So with the recent G7 pledge of 1 billion doses to low-income countries, and with partners like the MasterCard Foundation, working with the Africa CDC, progress is being made. I think we need to understand the scale of need and very much the urgency with which these vaccines now have to start to be delivered in order to really make a public health difference. First of all, we have vaccines. African people have been vaccinated with the first dose of a vaccine that really needs a second dose in order to work optimally. And these supplies are proving to be a huge struggle. So the urgency of having the vaccines available right now is huge. I'm not quite sure I'm still connected. I see my screen is turning around as if we have a connection problem.
You are connected.
Okay, so this is the scale. These are the numbers. I think what has been announced as you know, is a very good start, but it is nowhere near these numbers. And I'd just like to emphasize as well that the issue goes beyond donation of doses. The African Union has established a platform for procurement of doses. They have mobilized themselves in a quite unprecedented way, I have to say, in terms of political leaders in Africa, mobilized private sector leader, put together a team to go looking for vaccines for African countries. So there also needs to be a change, a shift in the pharmaceutical manufacturing companies and some of the wealthy countries that have not only procured vaccines, but that have paid in advance for supplies of vaccines to enable African countries through this mechanism of the African Union to procure these vaccines, so that it's a real partnership of donations and opening up space for Africa to access vaccines to buy in order to deal with the really huge disparity, which is a situation at present. So in short, the donations are appreciated. The volumes need to be very significant, and it's super urgent that these start to be made available now.
Thank you, Dr. Moeti. Then the next question is from Sarah Kimani from SABC News. The first question is to you, Dr. Moeti, and the second one is to Mr. Camille. EU countries in their vaccine passport requirement do not recognize the Covishield vaccine. She wants to hear your comment. And then to Mr. Camille, please quantify the losses to the industry this far and how long you think it will take for the industry to recover. Dr. Moeti, you go first, and then Mr. Camille.
Yes, thank you. So the Covishield vaccine, in terms of its technology, in fact, it's the AstraZeneca vaccine. The Covishield is being produced in India by the Serum Institute of India. And then there's another version of the vaccine which is being produced in the United Kingdom, which has been recognized by the European Union. So essentially it's the same product, but of course, in the process of issuing an emergency use licensing, there are aspects of the production facility that need to be assessed as well to ensure that the vaccine is produced up to the standards, all the safety precautions are taken into account within that individual production facility. Our view is that probably this has not been assessed by the EU because frankly, within the COVAX platform, this production was taking place, not targeting European countries. I think there was an understanding that there will be production in different places, and therefore it's perhaps not surprising that that assessment has not happened. And therefore it has not received the emergency use licensing from the European Medicines Agency. But as I said in my remarks, WHO has carried out this assessment and issued an EUL for the Covishield vaccine, which is something that a function that WHO carries out for all countries, whether they be African countries with regulatory capacity gaps, or we hope other countries with the availability of capacity, but still taking advantage of this multilateral facility within WHO, then to make their own decisions in order to facilitate, as we are talking about, international travel, etc. So we are hoping, we've understood that the guidance by the EMA has been to provide licensing to 4 vaccines, which do not include the Covishield, and then it is left up to individual countries to decide. I think, for example, countries like Greece have approved some vaccines. I believe they've approved Sinopharm, which has not yet been EUL'd by the EMA. But our hope very much is of a global platform like WHO being used by national authorities to, if you like, shortcut some of the processes that have to be done at the individual level. We believe that the facility for which member states have contributed, because they fund WHO, which works with independent experts, is up to the standard that can be accepted everywhere. And we are hoping it can be of use to countries to facilitate international travel.
Thank you, Dr. Moeti. Mr. Camille?
Yes. So the question was quantify the losses and when are we expecting a recovery? So globally, aviation industry lost almost $430 billion. In Africa, this is about $7.8 billion for the year 2020. This is predominantly down to the loss of traffic, of course, passenger traffic. Some of the regions in the world are recovering right now due to domestic traffic increase. So the US, China, for example, the domestic travel has almost returned to 2019 numbers. And there's a quick recovery there, but international travel is very slow because of the restrictions between borders. And therefore, looking at the situation today, I think the losses will stop or will reduce to an acceptable level by the year 2023. And the airlines will only start generating positive revenue and cover previous losses by the year 2024. Unless things change dramatically, which I can't see, the aviation industry is going to suffer for a few more years. Thank you.
Thank you, Mr. Camille. The next question is coming to you, Dr. Nixie. This is from Pamela from Uganda. How many cases of the Delta variant have been recorded in Uganda and the DRC? Are they responsible for increase in the number of deaths in Uganda? Over to you, Dr. Nixie.
Thank you so much, Mary. We can look at the latest data as far as the sequencing activities concerning these two countries. So what we have analyzed, we have realized that in DRC, about 79% of the cases of the very recent data for sequencing have been confirmed as variant, whereas in Uganda, about 97% of those cases have been confirmed. So we can see that both countries are really in each and every recent information or recent sequencing data that we are receiving here in WHO, it seems as if more than 10% of those cases are confirmed as a Delta variant. And in terms of are they responsible for the death that has been recorded in these countries, some of them, when we get the information, they have an information that some of these deaths are associated with the patient that identified to be having the Delta variant, but not all of them. So that is a situation for those countries.
Thank you, Dr. Nixie. The next question is back to you, Mr. Camille. This is from Kate Nathan. The new Africa Union travel pass, is it compatible with the AITA travel pass? Will the information from one be transmitted to the other? If not, why not encourage the AU just to support the AITA travel pass instead of creating its own initiative?
That's actually a very good question. So AITA is not trying to push its product. We are advocating the reopening of the skies and back to travel. What each state decides to adopt and what airlines decide to adopt is entirely up to them. So the African Travel Pass is fully compatible with the AITA Travel Pass. And in fact, if we can support anybody in developing a travel pass in line with our travel pass or work with governments, which we are doing, to integrate the AITA travel pass into their homegrown government system for border control, we are very willing to do that. The objective is not a commercial objective to sell a product. The objective is to work together in a collaborative manner to reopen aviation. And that's the important thing. And there are a number of points that we have to focus on which is the standards that need to be adopted in these travel passes, the certificate standards, the QR codes, and so on and so forth. And I have to admit that I believe the WHO did amazing work on this, and we fully support the WHO standards for the digital documentation. We'll work with all the governments, all the stakeholders, all the airlines in opening up aviation rather than focusing on a specific solution to do so. Thank you.
Thank you, Mr. Camille. The next question is to you, Dr. Moeti. Vaccine hesitancy is a concern, particularly regarding attitudes towards the AstraZeneca vaccine. Are any national health system able to offer the resources needed to manage fears around blood clots and other potential side effects so that the uptake will increase? And if so, could you give some examples?
Yes, I think that indeed we are very concerned as well about vaccine hesitancy, as we are expecting in some months that the vaccine supplies availability in Africa will very much increase. So the last thing we want is the continued slow pace of vaccination of people due to some people being hesitant. First, I'd like to emphasize what I said before, that in looking at data reports on adverse events from African countries, there have been very few reports of severe adverse effects. We have seen reports of mainly mild effects, fever, pain at the vaccination site, etc., in African countries, which is to be expected. So I think the first information to go out there is that these rare events, they're very rare events, that's something else that needs to be emphasized, which have been recognized in the AZ and, by the way, other vaccines as well. It was very loudly talked about as far as the AstraZeneca vaccine was concerned, and we saw countries pause the use of this vaccine, but other vaccines as well have been shown to have some similar side effects. These are rare events. And we think African countries, ourselves, other partners that are working at the community level with organizations like UNICEF and our platform on the infodemic for working with the social media companies to disseminate the correct information, we should all put our efforts together to let people understand this. We are working as well with countries to make sure that they take into account as part of the monitoring of adverse effects and ensuring that, that the healthcare systems are alerted to the possibility of these adverse effects, that there's preparedness for this. So preparedness to deal with the case of clots apparently it's mainly in young women, and to be alert, to have a certain level of alertness. This is something that we are working on developing in countries so that it can be part of the communication to reassure communities that it is safe to use the vaccine. It's very important to take the vaccine. And if you happen to have an adverse effect, the system will be somewhat ready to support you. So this is progressively being done by our teams on the ground and our partners to reassure people and to improve the preparedness in terms of case management in case of adverse effects.
Thank you, Dr. Moeti. And then I'm coming back to you again with this question. Richard can weigh in as well. What is WHO doing to ensure that Africa is not left behind, even as it becomes a reality that we are running out of vaccine? What is your take on European countries that rejected the use of AstraZeneca vaccines, and now they are recommending and donating the same to poor countries?
Okay. Thank you. First, what is WHO doing? I think we're doing, I could call it everything possible, really, to ensure that vaccines become available. At the global level, at my own level, we are advocating with countries that have supplies of vaccine that have enabled them to vaccinate their highest priority subgroups, population subgroups, which were starting with healthcare workers, frontline workers, and with older people with comorbidities, the type of diseases that make them vulnerable to severe forms of COVID-19 illness and death, to share the vaccines in a way that I've discussed before, to donate in significant quantities and to release some of the vaccines for procurement by Africa's platform. We do this at all levels. The Dr. Tedros, our Director General, and our colleagues who are working on the vaccine procurement at the global level, myself, are doing this all the time. And then secondly, we work as part of the COVAX platform to support all the steps of acquiring vaccines, and at the country level, very much work to deliver vaccines that are available, providing support to countries to have developed their plans for delivery of vaccines and providing technical support to them. We are in contact with some of the financing agencies. We're speaking to the World Bank, the African Development Bank. We've been in contact with Afreximbank to understand the financing side of things. And we are also very much advocating with African governments to take up their part of such financing as is available, so that they can not only help to procure the vaccines as part of these platforms, COVAX and the African Union's AVAT platform, but very importantly, that when the vaccines are available, they're able to pay for the delivery operations and deliver the vaccines to populations all the time. So this is what we're doing to support the process. We have observed that certainly our work in COVAX has been hugely challenged by the vaccine availability realities, both because we were very much relying on India as a producer, and India then had a very terrible situation of COVAX and stopped producing, but we're looking at other vaccines all the time. So we're working at the policy level, advocating, technical level, supporting our countries to carry out the delivery operations when the vaccines are available. And as for the experience of the AZ vaccine, I think we have to acknowledge that, you know, the development of these vaccines has been super rapid, and that has been a very positive development. So scientists, investors, governments, partners like ourselves worked together to develop these vaccines relatively quickly. And we've had some stumbles with the vaccines, as will naturally happen as the vaccine starts to be deployed in the population. There are some adverse effects that will come to light, and countries have taken decisions to stop and then start. I'd like to say that the AZ vaccine is being used by European countries. It is one of the main vaccines that they're using. And what happened was that some countries paused its use while they studied the data on some adverse effects and then restarted its use. So there is in no way, and here this might be an impression, there is in no way a situation where an inferior vaccine is being provided to African people. On the contrary, we are struggling to get access to supplies of the vaccines that have been licensed for use, and would very much appreciate getting supplies of this AstraZeneca vaccine, and would like to assure African people that this vaccine is efficacious and it is safe. And if it's available in your country, please go along if you are in the group that's being vaccinated and get vaccinated.
Thank you, Dr. Moeti. Richard, do you want to weigh in?
Well, no, I think Dr. Moeti really said it all. Yeah, thank you.
Thank you very much. Then to you, Mr. Camille, your question is coming from Peter from BBC. According to your projections, how soon will African countries be back, and what key actions are needed to turn around the sector?
Okay, so we're hoping that the African countries, or the African aviation, let's say, starts up as soon as possible. There is no reason for it not to start up. What we would like to see is governments and stakeholders and regulatory authorities and the airlines working together to start up aviation once again. There's no reason for all these restrictions preventing aviation from restarting in Africa at all. What needs to be done is the three items I discussed in the opening of today's event. The first is, of course, that we have to make sure that the aviation industry, and that includes not just airlines, but things like ANSs, airport operators, ground handling agents, maintenance organizations, training organizations, and so on, to make sure that they have revised their training requirements, are up to date, and not rusty in general, because the last thing we want to do is to suffer a safety event. So the first thing that we need to do is to make sure that the aviation industry is safe and has taken all the necessary requirements to become safe and ready to operate. The other two items is the first, of course, being the restrictions that are imposed by states for traveling. These restrictions are the reason, the predominant reason for passengers not to deciding not to travel. It's too complicated. And I faced that a month ago when I traveled to 2 separate countries. It was a nightmare for a person who travels 20 or 30, 40 times a year to go through what I went through just because I traveled to 2 destinations. It was ridiculous. It took ages at the check-in desk. There were different requirements. I had to download different applications and run different books, doing bookings for hotels and so on in front of the agent. It's not doable. These restrictions need to be unified, simplified, and adopted as per what ICAO and WHO and AITA have been recommending all these months. And of course, the last and most important thing is also the standardization and digitalization of the health credentials. Of course, that means that you would need to use an app similar to the AITA Travel Pass. We're working heavily with all the agents, heavily with the airlines and governments to try to get everybody on a single platform if possible. It's impossible to have a country develop its own solution and expect another country to adopt the first country's solution. You need to tie in a common solution that's accepted by all countries and all airlines. And that's why we believe that AITA Travel Pass is a solution, because we are neutral and we're global. We can connect all the aviation stakeholders together through an application that has been thought out very carefully and it functions very well. Those are the 3 things that we need to do collaboratively to make sure that we can open up the aviation industry. I'm assuming that as things improve, hopefully that the aviation industry will pick up. But I'm looking at, I think before we can get back to normal numbers, we're looking at the year 2023, maybe 2024 before the numbers reach 2019 numbers, unfortunately.
Thank you very much, Mr. Camille. The next question is coming to you, Dr. Nixie. This is from Rose Roselle from the Evening Standard in London. Which countries are the ones that are of greatest concern at the moment? And is the Delta variant the most dominant strain? Then the B part of the question I would like Richard to answer: can vaccines arrive in time to avoid the 4th wave in Africa? So we start with you, Nixie, first, then we go to Dr. Richard.
Thank you, Mary. I think to look at the countries of concern, I think are the ones that they've reported to be having some research. So these countries we can namely like by the few, like Algeria, DRC, South Africa, of course, Sierra Leone, Uganda, and Zambia. And then in some of these countries, we know that the Delta variant has been reported in the south part, in addition to Botswana and South Africa. We know that Zambia, Zimbabwe, as well as Mauritius are part and parcel of the countries that have reported variant. And not only the countries the southern part that have reported the Delta variant, but also the variant has reported in other regions within the continent. In the West, we also have got about 5 countries that have reported the Delta variant. In the central, we've got DRC. Also in the north, we've got Morocco, and of course in the east, we've got 2 countries that have reported the Delta variant, that is Kenya and Uganda. Just to go back a little bit, Mary, to the percentage of the Delta variant that have reported earlier on for the 2 countries, that is Uganda as well as DRC. So I've said for the recent data that, meaning that the number of cases that has been sequenced for these 2 countries, in Uganda, 97% of those cases were counted or were confirming to be associated with the Delta variant. And then 79% of those recent cases being analyzed were associated with Delta variant. That's it from my side. Then you can come back if there's more clarity needed.
Dr. Richard, thank you, Dr. Nixie.
Yeah, thank you, Mary. I think that's a very, very good question, but even before thinking of avoiding a 4th wave, I think the current urgency is really to get the vaccine now so that we can deal with countries that are going in this 3rd and to some countries in the 2nd wave. So the more we get vaccine, the sooner we get vaccine, the better. I think Dr. Moeti elaborated quite very well all the efforts that are currently being done to get the vaccine now in the arms of the Africans. So we do hope that particularly in the last part of the 3rd quarter, including the last quarter of the year, we will see a substantial number of supply that will come to Africa, and all the preparatory work that is currently being done. We hope that we will get to a point where we are going really to ramp up the delivery of the vaccine, and that's what definitely we will avoid country to go into a potential 4th wave. So I think vaccines are needed now and immediately, probably to deal with the issues that we are facing now, even before we think on the potential 4th wave in the future. Thank you.
Thank you, Dr. Richard. The next question is to you, Mr. Camus. How many airlines are using the AITA travel pass?
Okay,
African airlines, yes.
Yeah. So the exact number changes from day to day. It's increasing. We are working flat out with all the member airlines and other airlines and entities, including governments, setting up the AITA travel pass right now. So I mean, we have a number in Africa and we have a number in the Middle East, but internationally we have a lot of airlines at different phases within the program. So there are essentially 3 phases in the AITA Travel Pass program, and most of them are in the 2nd phase and almost in the final phase of clicking on the AITA Travel Pass to use. Of course, if you understand how complex the AITA Travel Pass is, you'll understand that it's not just flipping a switch. It's more of a process where you then have to engage with the laboratories around the world to make sure that they also are able to feed into the AITA Travel Pass whether it's the test results, and then you want the governments to feed in, or a way to feed in your vaccination certificates and so on and so forth. So it's not just simply working with airlines to get the AITA Travel Pass to work effectively, but it requires a large number of stakeholders before you can get the full AITA Travel Pass to work correctly. Right now, we're testing at the final phase with 60 major carriers around the world. And some are already up and running, and some are on the final phase of starting. The important point I also want to mention, listening to some of the conversations just now about the vaccination is that as Africa struggles to get enough vaccinations, Africa needs to realize that it needs aviation to deliver these vaccinations. And I'm talking about the aviation industry as a whole and the airlines particularly. If governments neglect the aviation industry, you can have an airport shutting down or not capable of handling the cargo, the offloading of cargo from a 777, for example. So governments need to engage right now with WHO and AITA and ICAO to make sure that they keep their aviation industry in their respective countries alive so that they can actually handle the large quantities of vaccinations that will be coming into their countries, most definitely through an airline. Thank you.
Thank you, Mr. Camille. Dr. Moeti, you wanted to weigh in, but let me give you a question and so you can answer them together. This question is coming from Victoria Moses from Europe and Africa Bureau of Chief Air Transport. This is the concern about the EU vaccination passport. She says the vaccination passport recognizes only 4 vaccines. This creates fear and raises questions in Africa. People are wondering if other vaccines are safe. So what is your reaction to this concern? And do you think this will affect the campaign in Africa?
Yes, thank you. Thank you very much. I think that's a very important question. And it's very much part of the work that we have to do. First, to have people understand this whole process of emergency licensing of new vaccines by different entities who have a regulatory authority role at the national level. And in the case of the European Medicines Agency at the regional level. And to say that indeed we need to communicate for people to understand this is not that something is wrong with this vaccine, and to send the word out there that this vaccine has been emergency use licensed by the World Health Organization's regulatory team that has assessed it and that is doing that on behalf of the member states of the world, as is WHO's role at the global level as a multinational organization. And that it is our hope. And yeah, I have to say that there is a close collaboration between WHO's regulatory team and the regulatory platforms, organizations around the world. So in some of the Western countries, they work with the FDA, they work also with the US CDC, and they're working and in constant contact with the EMA. We also have, by the way, in Africa, a forum of regulatory authorities, the AVAREF, who are very much taking on board WHO's emergency use licensing among their national organizations and promoting that this be adopted in order for them to rapidly give emergency licensing. So we are hoping very much that this will also take place with the European countries through the EMA so that we prevent African people starting to reject vaccines that have a WHO emergency licensing but have not been licensed by other authorities. This is very important. And of course, we know that the connection, the link between African countries, African people, and Europe is very strong. And I'm aware that there has been concern in some countries as the EU member state embassies have set up mechanisms to inform the populations of these measures. I hope this is something that can very soon be resolved so that good vaccines can be that have been assessed by WHO can be recognized rapidly by member states to facilitate the travel that will be safe. And I very much would like to echo what Mr. Alawadi has said about the importance of using these multilateral platforms, mechanisms to facilitate matters between countries. It's very important for the reopening for normal business, normal travel, countries, economies, in a safe way, and emphasize that our responsibility is to make sure that from the public health perspective, all this is safe. Now, what I wanted to add to Richard's response about how to prevent fourth waves is, of course, in addition to the rollout and delivery to people of vaccines, we must reinforce the public health measures that have started to weaken as this situation has gone on for over a year and people have become a bit tired. In some cases, people have become a bit complacent. So those imperatives, as I said in my introductory statement, to use masks all the time, continue the distancing process and the hygiene measures, washing your hands. These are very important adjuncts to the use of vaccines. And we'd like to remind people and would like to encourage governments to continue to communicate, support people to play their part.
Thank you, Dr. Moeti. We are coming to the end of this media briefing. So we will turn back to our panelists for their final thoughts. I will start with you, Mr. Camille. You answer this question first and give us your final thought. Has IATA explored non-discriminatory ways to facilitate reopening of the skies in light of the limited vaccination coverage in Africa and other low-income parts of the world?
I'm sorry, I didn't quite get the question.
Okay,
Mary.
has IATA explored non-discriminatory ways to facilitate reopening of the skies in light of the limited vaccination coverage in Africa and other low-income countries around the world?
Yeah, well, so we're not connecting. I mean, we have advocated that the vaccines are not a precondition for travel, okay? And that's to ensure there's no discrimination whatsoever between countries or nations or regions. We have developed, in line with WHO and ICAO, reopening standards, and I think the aviation industry as a whole agrees on these standards. And it doesn't include any discrimination at all. And in fact, I think both IATA, ICAO, and also the WHO fully agree that vaccinations is not a precondition whatsoever for travel. It's having the right balance and checks and tests and certifications that control the travel, and it's not the vaccinations whatsoever.
Thank you. And your final thoughts?
My final thoughts is as follows, and I'm going to be very transparent. There are many experts in many entities on planet Earth that have been working together to reopen the aviation industry, and Africa is no different. WHO, ICAO, and AITA have been working hand in hand to try to reopen the aviation in Africa. I understand that when COVID first started, there was that fear factor, an unknown factor last year. That was 12, 13, 14 months ago. I think now the world has a very good understanding of what the virus is and how to be safe from it, okay? And it's time that governments, first of all, supported their aviation industry as a whole, and then work together in a collaborative manner with IATA and WHO and ICAO to remove these very harsh restrictions and adopt a unified process so that we can open the aviation industry, whether it's domestic within Africa or internationally to other continents. But we need to work collaboratively, keeping in mind that the aviation industry is sinking very rapidly and it needs governmental support.
Thank you, Mr. Camille. And now to you, Dr. Moeti. I'll give you one question from Bloomberg, and then you incorporate this into your final thoughts. How does South Africa's recent announcement on mRNA vaccine technology transfer hub fit broadly into WHO's work to expand vaccine access worldwide?
Yes, it's a very positive development. It's a very positive step, because actually what's being established is, of course, a local production facility working with with an existing pharmaceutical company, the South African government, but it's also going to be the first hub that's going to be used for capacity building, training, engagement beyond South Africa to other countries. I think it's a recognition, it has hit home now that the situation cannot continue, that African countries have no production facilities for vaccine. We are a very big user and consumer of vaccines of different types. And I'm very hopeful, I'm quite certain that this is the beginning of a transition where Africa will play its role. We'll always need to be importing some of the vaccines from some of the big producers like China and India, but it's a very important step towards vaccine production on the continent, and it's something that we very much welcome as WHO, as do other stakeholders who have an interest and a stake in Africa's public health. And then just to close, I'd like to first thank Mr. Alawadi very much for having joined us and shared what you are doing, and reiterated very much the importance of working in partnership, and the fact that these multilateral platforms and initiatives can transform what countries are doing and serve to ease the collaboration between countries in facilitating travel. Thank you for emphasizing the importance of the aviation industry for contributing to the response for COVID-19, including in the supplies. I can tell you lots of stories about how we relied on the aviation industry for the public health related materials, test kits, drugs, etc., for public health in Africa, particularly for the pandemic. And then I'd like to reiterate what I said about WHO's role as a multilateral organization, and this service is offered for the decision-making of countries, and remind in reiterating also what Mr. Alawadi said about using vaccination status as a condition or not of entry into countries, that the international health regulations discourage this, and that there are robust other means of enabling that travel and entry into states is safe, that the experience that we've had over the last year has enabled these platforms to be put in place. And we encourage member states to remember their IHR obligations and to use these technologies to enable safe opening up and international travel. And then finally, as usual, just remind our colleagues in the media, and thanking them for having joined us, that please continue to spread the word about what individuals can do, what public health measures people can put in place at the individual, at the household level. And we are here to support that at all levels of WHO. Thank you all for having joined us.
Thank you very much, Dr. Moeti. We have now come to the end of the media briefing for today. A very big thank you to our great panelists, and to you, the media, for the great work you are doing in making sure that the right information goes out there. Briefly, we will have colleagues, Dr. Tiano and Dr. Richard. They will be around to answer some of those French questions that we have. Thank you and have a great day. See you next week.
Oui, bonjour et bienvenue à cette partie entièrement en français de la conférence de presse de l'OMS Afrique. Comme il a été dit, et comme la semaine dernière, nous avons deux experts du bureau régional de l'OMS pour l'Afrique avec nous, le docteur Richard Mihigo, qui est coordonnateur du programme de vaccination de la mise au point des vaccins, et le docteur Tierno Baldé, qui est chef de l'unité des partenariats opérationnels. Nous avons un peu moins de questions cette semaine, donc je vais commencer avec vous, docteur Richard Mihigo, avec une question de Stéphanie Gardier du Figaro. C'est une question qui concerne les variants. Que sait-on pour le moment de la présence du variant Delta, et en particulier aussi du Delta Plus en Afrique, et que sait-on en général des variants africains? Quelle est la situation concernant les variants africains. Docteur Richard Miego, êtes-vous tout...
Merci Vincent. Je vais commencer par répondre et mon collègue Baldé pourrait éventuellement compléter. Comme nous l'avons suivi dans la première partie de l'interview, le variant Delta a été est maintenant de plus en plus présent sur le continent. Et par rapport, par exemple, aux pays comme la RDC ou l'Ouganda qui sont en train de vivre une troisième vague extrêmement importante. On a vu qu'en Ouganda, environ 97% des échantillons qui ont été faits sont rentrés positifs pour le variant Delta. Ce chiffre était autour de 76 ou 78% pour la RDC. Donc, ça devient pratiquement le variant le plus dominant pour le moment, mais nous avons également des pays en Afrique australe, notamment la Zambie, Botswana, même en Afrique du Sud et au nord du continent également. Donc, nous avons quand même une circulation maintenant, malheureusement, de plus en plus active du variant Delta, qui est dans beaucoup des pays responsables de cette vague importante que nous sommes en train de connaître en termes de troisième vague. Alors, en ce qui concerne le variant Delta+, qui a été effectivement notifié dernièrement en Inde, je n'ai pas d'informations là-dessus sur la circulation actuelle de ces variants Delta+. Mais pour ce qui concerne les variants africains, effectivement, l'Ouganda, par exemple, a déjà notifié ce que nous appelons des variants d'intérêt, des variants of interest, localement. Et nous avons également détecté des variants locaux, que ce soit en République centrafricaine, qui ont été détectés en Angola. Donc, toute la structure de surveillance génomique qui a été mise en place, maintenant, nous permet de prendre des décisions ou d'informer les pays de manière, cette fois-ci, plus précise sur la circulation spécifique de certains types des variants. À vous.
Merci, docteur Migo. Docteur Baldé, est-ce que vous voulez ajouter quelque chose sur ce sujet?
Oui, juste pour compléter, effectivement, donc il y a vraiment une présence simultanée donc, de ces différents variants-là. Le docteur Migo mentionnait des pays comme l'Ouganda et la RDC, mais il est important aussi à noter que dans les pays d'Afrique australe, on a toujours donc, la prédominance du variant bêta. Ça, c'est quelque chose d'important. Vous savez, les pays d'Afrique australe sont ceux actuellement qui font face à cette crise de cette troisième vague, donc les pays comme la Namibie, comme la Zambie, l'Afrique du Sud. Donc, c'est encore le variant Delta qui est là. Et dans les autres pays donc, de l'Afrique de l'Ouest, depuis un certain nombre de semaines, on a une conjugaison donc, des variants, surtout qui sont alpha, les variants alpha qui étaient initialement donc rapportés du côté donc de la Grande-Bretagne, mais aussi une combinaison donc du variant bêta. Donc on a fait un mix vraiment de ces différents variants-là. Et évidemment donc il y a le variant le plus prédominant étant le variant sauvage, donc le variant initial donc de ce virus-là. Donc il y a une phase véritablement donc de compréhension, donc d'identification de ces variants-là et aussi d'adaptation quelque part donc des mesures donc de surveillance et de réponse qui sont en cours que nous faisons ici donc de façon régulière et de façon très en étroite collaboration avec nos pays membres et avec nos partenaires. Merci à vous.
Merci beaucoup. Mais écoutez, je vais vous poser le deuxième et dernière question que nous avons et peut-être que Dr Migo voudra aussi ajouter quelque chose. C'est une question qui nous vient de Lawal Boubacar de l'ORTN au Niger et qui concerne essentiellement les rumeurs qui circulent concernant les vaccins. Il évoque en particulier le cas d'une vidéo qui affirme qu'une puce RFID serait injectée dans le corps de la personne. D'autres rumeurs affirment qu'une personne vaccinée ne peut pas vivre au-delà de 5 ans. Et il évoque le cas du Niger où 70% de la population est analphabète. Quels moyens l'OMS emploie-t-elle pour communiquer et éclaircir ces informations dans ce genre de contexte?
Merci beaucoup. Je vais commencer. Certainement, le docteur Migo pourra me compléter aussi. Donc, vous avez entendu tout à l'heure la directrice régionale parlant un peu de tout ce pilier-là qui a été mis en place donc, par l'OMS pour pouvoir véhiculer les bonnes informations, pouvoir suivre les informations qui circulent dans les réseaux sociaux, des informations similaires, par exemple, à ce que vous mentionnez là. Donc, il y a un effort constant et régulier qui a été entamé depuis plusieurs mois pour pouvoir donc véhiculer les bonnes informations, pouvoir détecter d'abord les informations qui sont relativement erronées et pouvoir donc les corriger donc en temps opportun. Donc, c'est sûr que le contexte ici en Afrique, donc, il y a certains éléments qui sont favorables à cela, mais il y a beaucoup d'organisations qui travaillent aujourd'hui, beaucoup de structures qui travaillent pour pouvoir véritablement véhiculer la bonne information. Et je crois que c'est le moment de saluer ici aussi donc, le travail de la presse, comme le disait tout à l'heure la directrice régionale, pour pouvoir continuer à véhiculer vraiment les bons messages donc, aux différentes communautés, aux différentes populations. Il y a des organisations de la société civile et des partenaires tels que l'UNICEF, tels que la Fédération de la Croix-Rouge, ou encore même des organisations de la société civile avec qui nous interagissons de façon très régulière pour pouvoir passer donc les bons messages, que ce soit sur la vaccination, mais aussi sur l'adhésion donc des autres mesures de santé publique. Parce qu'une chose reste certaine, je pense que c'est la combinaison véritablement de tous ces éléments-là dans le contexte actuel donc de quantité limitée de vaccins qui nous permettra donc de pouvoir passer au travers cette troisième vague à laquelle nous faisons face dans de nombreux pays. Je vous remercie.
Merci, Dr Baldé. Dr Migo, vous voulez peut-être compléter?
Oui, très rapidement. Je voudrais d'abord dire que nous prenons réellement très au sérieux ces genres d'allégations, dont nous ne les considérons pas comme des allégations fantaisistes, parce que ces allégations témoignent un peu de l'inquiétude, des questionnements que les populations se posent. Et nous essayons réellement d'engager une conversation avec les communautés pour être sûr que les fausses informations soient bien entendu démenties et que la bonne information soit effectivement transmise au niveau des populations. Donc, il y a tellement de rumeurs qui ont circulé sur les réseaux sociaux ces dernières semaines ou ces derniers mois qu'à un moment, je comprends très bien le citoyen moyen se perd un peu dans toutes ces différentes allégations. Ce que je voudrais dire, c'est que la plupart de ces allégations, bien entendu, n'ont aucun fondement. Il faudra ici souligner qu'avant que les vaccins ne soient autorisés ou obtiennent une autorisation d'utilisation d'urgence par l'OMS, un processus extrêmement rigoureux est mis en place pour la vérification de l'innocuité, de l'efficacité, la qualité des produits. Et ce n'est pas quelque chose de nouveau, c'est quelque chose qui a été fait depuis toutes ces années. Nous le faisons pour la vaccination traditionnelle, la vaccination de routine, pour être sûr que les différents vaccins qui sont autorisés par les pays sont rigoureusement évalués, que ce soit au niveau de la chaîne de froid, mais également au niveau de leur utilisation effective au niveau des populations. Donc, je voudrais encore une fois ici rassurer notre collègue, rassurer les communautés que ces vaccins sont des vaccins sûrs, sont des vaccins efficaces et qu'ils peuvent réellement les utiliser sans aucun problème parce que nous les suivons de manière vraiment rigoureuse.
Merci énormément à tous les deux pour ces réponses très complètes et détaillées. J'invite aussi tout le monde à suivre l'OMS Afrique sur les réseaux sociaux, en particulier le travail de Viral Fact, qui a produit énormément de vidéos sur ce genre de rumeurs. Merci, Dr Migo, merci, Dr Baldé, pour ces réponses, ces questions supplémentaires, et rendez-vous la semaine prochaine.
Merci beaucoup et bonne journée. Au revoir.
Au revoir.